Hi there, welcome to this week's Ask Amy video. As you know, we've been talking a lot about the patient flow process over the last few weeks. Last week, we talked about the hygienist role with a new patient, and today we're going to talk about existing patients. I'd like for you to look at this a little bit differently than maybe you have in the past. With existing patients, we make a lot of assumptions, or maybe we brought treatment up before and they weren't very receptive, and so we don't really go there, or when we do, it's, you still have those 3 crowns to do. Have you thought about that? Well, no, they really haven't. And if they have, it's more along the lines of, gee, I hope she doesn't bring those up again. So let's just put that treatment over on the shelf aside for a little bit, and let's begin thinking a little bit differently. See, what I hear from some of you is, we've already kind of restored all of our existing patients. And then out of this other side of your mouth, you might be saying, but what are some things we can say when we're calling the pending list? So see, that really doesn't jive. That doesn't make any sense. And what I kind of pull out of that is, we have restored all of the low-hanging fruit, if you will. We've restored the patients who want to have their treatment done. But what about those who maybe you've missed the mark, or maybe our communication with them wasn't such that we really were able to help them connect the dots from their desired end results to our solution? And so, again, I'd like for you to think of this a little bit differently. Is it that they just don't have any value for it? And if they don't, why is that? What do they have value for? And why haven't we been able to identify that? So here's the thing. The good news is you already have a relationship with these folks. We keep thinking we need more new patients. And so you spend all this money and time and effort in getting new patients through the door only to treat them the same way. And so why not begin having conversations with your existing patients? You might just be surprised at what comes of it. So hygienists, here's something that I have found works really, really well with other hygienists, is to just simply have a conversation. Patient comes in and you have your chit chat, you visit with them for a minute, but then say, if it's okay with you, before I clean your teeth today, I'd like to ask you a few questions. I just want to make sure that we're on the same page. Or, I know we've taken care of things for you as they've broken or as you've needed to, but one of the things we haven't done very well is get your perspective and find out, what your expectations are long-term for your teeth. Is it okay if, I ask you a few questions before we get started? So, again, just put everything aside, almost treat this as if, you have a brand new patient in your chair and you're doing sort of an interview. And so, again, don't just bring up the treatment just to bring up the treatment. Get them out of the here and now, get them thinking down the road. And you know what? Maybe there's some things that your doctor's been watching or that you guys haven't even thought of, that when you ask these questions, the patients will bring up. And so don't assume anything. Don't take anything for granted, and just simply have a conversation. Here's kind of how this will work. Have a transition. Again, you get to know them, or you already know them. You get caught up to speed on their family, their life, what's going on, and then just transition. Is it okay if I, ask you some questions? We've done things a little bit differently since you were in last, and patients are really enjoying being part of the process. And then establish or reestablish their goals. Even if you did this 6 months ago, you might acknowledge that and say, we've talked about this before, but, it's been 6 months. I know circumstances can change. So I just want to make sure I understand where you're at. And then, after you do that, ask, do you want our help with this? Now that we've kind of know where you're headed and what you want to accomplish short-term, long-term in terms of the health of your teeth, would you like our help? What if we were able to sit down and come up with a long-term plan? You get to go at whatever pace you choose. And that way you kind of know what to expect down the road. What do you think? Which is the last part, inviting them in for a planning appointment. See, really, if you think about it, you shouldn't just be having planning appointments for your new patients. Your existing patients are wonderful opportunities for that. Patients that come in regularly for cleanings but just don't seem to be, interested or valuing the treatment. Those patients who maybe have been in before on an emergency basis and they just seem to come in for every emergency. Those are wonderful planning appointment candidates. And so we'll talk about that a little bit and converting emergencies with the assistant part. But hygienists, I challenge you to make a point to have this conversation with every existing patient that comes in. You're already chit-chatting with them. Just I know you're limited on time, but make that meaningful. And just kind of have a temperature check, see where they're at and how they'd like you to help them. So that is your existing patient. Again, I'll look forward to hearing stories and hearing of how you've had these conversations with patients instead of just bringing up their pending treatment. I am here to help you however I can. Feel free to email me. You can see the email address down at the bottom of the screen, and I'll answer any questions that you'd like. Also, be sure that you download in the email this week the companion packet that goes with the existing patient part of the hygienist role. You can also get that on our website. So I will look forward to seeing you next time. Bye-bye.